WWL TV, the spirit of Louisiana. This is Louisiana's news leader, Channel 4's Eyewitness Morning News.
With access to health care more unstable here in New Orleans, some public school students are finding an alternative.
I know I could talk to if it's a grown-up, stuff I don't even tell my parents. I could go to tell him and like release the pressure and the stress and all that and just talk to him. Very good man, I love him to death.
Coming up in the next hour of the Eyewitness Morning News, we'll have more on these clinics that are available for kids and their families.
Stay tuned.
It's 7:10. We have lots coming up in this hour of the program. Health care for some parents just got a bit easier. If your child's school has a school-based health center, we'll tell you how you can have access to the same services.
Going to school has its benefits, especially when it comes to health care. Several campuses around New Orleans now have school-based health centers that are making it easier for those in need of services.
Some of us can't afford or have the time to go to the doctor, and we get to come here and get free help and great help, and it is very helpful to me and my peers.
What's even better is that the clinics are available to students' families, at least some of them. Here with more are Marsha Broussard, Director of School Health Connection, and Dr. Melissa Nass, Assistant Professor of Clinical Pediatrics and LSU Health Sciences Center, Department of Pediatrics, rather. Thanks so much for being here.
Thank you.
There are these health clinics that are sponsored, I assume, by LSU. Are all of them put on by LSU?
No, 3 in this city are sponsored by LSU Department of Pediatrics, but there are 14 school-based health centers in all in Orleans and Jefferson Parish who have a variety of different sponsors.
And what can students access at the health centers? Are they different in each school?
So
either one of you.
School-based health centers really provide comprehensive health care services on school grounds located where students are at school. And we provide a variety of services. We can do immunizations and sports physicals and comprehensive physicals. We can do nutrition counseling and other types of counseling. Additionally, we have behavioral health counseling, which is a very important part of our program, and some of the clinics have a dental program.
How do students access it? Do they just have to walk in, or do they have to sign a consent form? What are the rules?
At the beginning of the school year, typically, students sign consent forms during the enrollment process. So it's very simple. When the parents get their packets for kids, they fill out the school-based health center consent form with all the other forms, and it's done. They can do consent later in the year if they, for some reason, don't enroll at the beginning and something comes up, they end up at the school health center for services, then they can enroll at that time, but with parental consent.
What's the volume of patients that ends up coming through them? Is it different at every school, or?
I think it probably differs among site, and it differs depending on the school and time of the school year. At the beginning of the school year, we are very, very busy, and we could see more than 30 patients in a day.
What's the greatest need that you all see?
That's a great question. I think behavioral health services is a huge need in our school communities.
Which, for people who don't know, kind of explain what that is.
So behavioral health services are mental health care services, and in order to be a school-based health center, you need to have some sort of behavioral health counselor. Most schools have a social worker or a licensed clinical social worker working with the students, and they see a variety of different issues.
And so that is something that a lot of people have difficulty accessing in the community, and so this is one of the only places that they can get it.
Well, ordinarily, yeah, that's true. Ordinarily, mental health services aren't always integrated into primary health care, but in school health clinics, we do it differently. When a young person comes in for their comprehensive physical, they're also given a general screen for mental and behavioral health issues. So it's integrated into the model. And immediately, if there are any flags whatsoever, then they are able to see the behavioral health specialist.
There's also nutrition and weight loss counseling that students can access at these health clinics. What kinds of things do students need most? I mean, we know that there are issues with hunger and kids not even being able to afford lunch or dinner. So what kinds of nutritional information do they typically need access to?
Sure. So we do a lot of healthy lifestyles, behavior modification in our clinics, educating the kids about healthy choices around choosing foods and exercise and activity levels.
And our data shows, because we do evaluate our clinics, that kids who have access to a school-based health center are more likely to be conscious about their weight and also to be engaging in physical activity and just nutrition modification if they are overweight or underweight as well, but particularly if they're overweight.
So final message from both of you is take advantage of these services. They're there for a reason.
Absolutely.
All right. Thank you so much, ladies, for being with us. We appreciate it.
Thank you.
Thank you.
And to get a list of the locations and hours for those school-based health centers, just go to our website, WWLTV.com, and click on links on 4.